Most people wouldn't think to associate the liver with body temperature, but this quiet, deeply embedded organ is one of the body's most important thermostats. Beyond its better-known roles in detoxification, digestion, and nutrient processing, the liver plays a subtle but powerful role in regulating internal heat. Acting as the body's biochemical furnace, it helps keep your temperature within a tight, life-sustaining range, neither too hot nor too cold. When liver function falters due to illness, inflammation, infection, or toxicity, this thermal regulation can break down, leading to unexplained chills, sweats, or fevers. And yet, this link is rarely taught outside of intensive care units or advanced physiology courses. To understand why the liver matters so much in temperature regulation, you have to look at its metabolic intensity. The liver is one of the most energy-demanding organs in the body, second only to the brain in oxygen consumption at rest. It's constantly processing nutrients, detoxifying waste, synthesizing hormones, generating bile, and maintaining glucose levels. All of these tasks produce heat as a byproduct of metabolism. In fact, the liver accounts for nearly 20% of the body's total heat production, despite making up only about 2 to 3% of total body weight. This makes it a core driver of basal body temperature. At the same time, the liver helps regulate blood temperature through its massive blood supply. About 1.5 liters of blood pass through the liver every minute, filtered and chemically adjusted before being redistributed to the rest of the body. This high-volume flow allows the liver to act as a kind of heat exchanger, warming or cooling the blood slightly depending on the body's needs. If you're cold, increased liver activity can raise body temperature subtly from the inside out. If you're overheated, changes in circulation and enzymatic activity help reduce internal heat production. This isn't as fast or visible as shivering or sweating, but it's a constant part of thermal homeostasis. However, when the liver is under stress, whether from infection, inflammation, fatty infiltration, drug damage, or chronic disease, its ability to regulate both metabolism and blood temperature can be thrown off. In critical illness, for example, liver dysfunction often leads to temperature instability. This might present as low-grade fevers, intermittent chills, or wild swings between feeling hot and cold. In sepsis or advanced liver disease, this dysregulation can become dangerous, with body temperatures dropping too low, hypothermia, or spiking too high, hyperthermia, even without obvious external causes. Even outside of critical care, many people with liver dysfunction report unexplained body temperature changes. They may feel persistently cold despite warm surroundings, sweat excessively at night, or experience hot flashes unrelated to hormones. These are often dismissed or misattributed, seen as anxiety, menopause, or thyroid dysfunction, but they can also reflect impaired liver metabolism and blood flow regulation. In chronic liver disease, the inability to maintain stable glucose levels and manage circulating toxins may also contribute to these temperature fluctuations. Fever is another area where the liver plays a backstage but essential role. During infection or systemic inflammation, the immune system releases molecules called pyrogens that act on the brain to raise the body's temperature. But behind the scenes, the liver ramps up acute phase proteins and adjusts metabolism to support this fever response. If the liver is sluggish or overwhelmed, the body may struggle to mount a proper fever, leading to blunted immune responses or paradoxical temperature drops during infection. This is especially important in older adults, where low or absent fevers can mask serious illness, often because of impaired liver or immune function. Unfortunately, the connection between liver function and temperature regulation is rarely emphasized in general health education. People are taught to measure fevers, track chills, and stay warm when sick, but not to consider liver health as a factor in their body's ability to regulate heat. Yet a tired, inflamed, or fatty liver is like a struggling furnace. Its efficiency drops, its heat output becomes erratic, and the rest of the system feels off as a result. The encouraging news is that supporting liver function can improve thermal balance. A healthy liver maintains a more consistent internal temperature, responds better to metabolic stress, and recovers more quickly from illness. Nutrient-dense foods, adequate protein, liver-supportive herbs like milk thistle and dandelion, and antioxidant-rich vegetables help stabilize the liver's metabolic rhythm. So do habits like consistent sleep, movement, and staying hydrated, since water is a key medium for both detox and heat transfer. If you frequently experience unexplained temperature swings, chills without illness, or excessive night sweats, it may be worth considering liver health as part of the picture. especially if you also notice signs like fatigue, irritability, poor digestion, or sensitivity to medications. These are not just surface-level symptoms. They're clues to deeper metabolic imbalances, with the liver quietly at the center. So, while the liver may not come up when discussing body temperature at your next doctor's visit, it should. It's not just your chemical filter or metabolic workhorse. It's your internal thermostat, humming along beneath awareness, adjusting your temperature minute by minute to keep you alive. And when you support it, you not only feel more balanced, you stay resilient in the face of stress, sickness, and shifting seasons.